Hello, so we're going to continue to talk about bacterial disease. Now, first we're going to talk about meningitis. So what is meningitis? Meningitis, that is inflammation between the spinal cord and the cell membrane. And how we diagnose it? We usually get the sample from the cerebral spinal fluid, CSF. And then we can see using gram stain whether we have a certain pathogen. Now, what are the pathogens will cause meningitis? It could be Streptococcus Ammonia, it could be Neisseria meningitis, or Haemophilus influenza, or maybe some of the normal bacteria, that could be. Now, I want to mention is that meningitis, the pathogen caused meningitis is age dependent. So 0 to 2 months, that is group B Streptococcus agalactia, so we say GBS. 2 months to 5-year-old, that is Haemophilus influenza. Then 5 years to 40 years old, that is Neisseria meningitis. And the people, older people more than 40 years old is Streptococcus ammonia. Okay, that's important. It is age dependent. Now, what is the symptoms for meningitis? Of course, meningitis will be translated from the respiratory droplets. What are the symptoms? It's vomiting, headache, lethargy, confusion. Now, very important, people doesn't realize too much, is a tough neck, stiffness neck. Because when you have a stiff neck, you think maybe the muscle problem, but not really. Sometimes it could be meningitis. Now, it could be fatal, which means it could cause people to die. Now, here is some of the examples. We will talk about these later on, use video one by one. I will draw on the blackboard. So meningitis, there is some of the vaccine we can be using. But most of the time, if it happens, we use antibiotics. Okay, so Neisseria meningitis. Neisseria meningitis is actually gram-negative coffee bean shape, Coccobacillus. And it is widely happens for college students. People in the dorm and they go to the library, it's going to be transmitted there. And the first symptom usually is a tough neck. And they have a vaccine for that, but the vaccine usually not covered very well. It's about 60% coverage. So there's a debate in the university a long time ago whether the students should have a vaccine for Neisseria meningitis. Now the second one, Haemophilus influenza. This one not only will cause meningitis, also will cause ammonia. This one is usually, we call it #1 childhood disease in the United States and worldwide, because its average occurs 3 million worldwide per year. And we do have a vaccine. The vaccine called HIV vaccine, which is type V Haemophilus influenza vaccine, can be dramatically reduce the case. Now, the last one usually happen is for older people is Streptococcus Ammonium. We do have a vaccine. That's a vaccine coming from the capsule. And we call it a Pcv vaccine, and we do have antibiotics for that. Now, this is something very special for the Haemophilus influenza, type B. We call it HIV. First of all, this is a fastidious bacteria, which means this bacteria growing is very picky. They only grow on chocolate agar, not on TSA, which is we call a neutron agar, like we did in the lab, or like a blood agar. Not really. They only grow on chocolate agar. Chocolate agar is a blood agar heated at 70 degrees Celsius. So the fastidious bacteria can cultivate on chocolate agar. This guy needs 2 factors to grow on a regular TSA agar, which is X and V factor. X factor is hemming, and the V factor is NAD, nicotinic-adenine dinucleotides. It's an electron carrier. So they need 2 factors called XV factors. Now, this pathogen also have a very special characteristics. If you grow Staphylococcus aureus on the blood agar, then you see there's a white. There's a white colony smear there. Then this bacteria will be growing there like a this Haemophilus influenza can grow there using like a very tiny dots. And this is called a satellite phenomenon. Why we say that? Remember, this one needs X and V factor. X factor is hemming. On the blood agar, there's a hemming. And when Staphylococcus aureus grow on the blood agar, they will generate NAD. So they can be survived there. That's why Haemophilus influenza can survive there. That is called a satellite phenomenon. Okay, looks like single dots, very tiny dots surrounded this white smear colony. Now this is Neisseria meningitis. We mentioned about that. You look at the picture here, this is white blood cell. Then you see some of the gram-negative coccobacillus, which is coffee bean shape. It is coffee bean shape, looks like a coffee bean. Okay, that it's also a diplococcal. It's coffee bean shape. That is called Neisseria meningitis. Now, this is usually what they do. They get a sample from the cerebrospinal fluid, then do the gram stain. Then they find a gram-negative coccobacillus, coffee bean shape. Now, we do have a vaccine that's called Menomine, which is MPSV4, MCV4. Now, the story is the most serotype popular in the United States is A, B, C, Y, and W135. But this vaccine only covers A, C, Y, and W135, not going to cover B. So this vaccine actually is only like 60% protection. Therefore, a long time ago, there is a debate whether the college students should have this vaccine. Now in California, they require that you must have this vaccine, otherwise you can register for the class. But in Connecticut, in the northern New England area, they give you flexible. So I'm not sure what's the requirements in WVU or the Middle Atlantic city, but Atlantic area. But I do tell you, there's a big debate a long time ago because this vaccine is not covered too much. Okay, bird therapeuticus. This is another one. Remember DTaP, the last letter P is called bird therapeuticus. And this is the one, is a gram-negative coccobacillus. So we mentioned the coccobacillus, which means it's like a cocktail, like a bacillus. So we say it's a coccobacillus. Now, what is the major symptom for this bird therapeuticus is whooping cough. Whooping cough, which means a very productive cough. You have a cough, 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 then whirl. That whirl sound is a respiratory gasp, okay, causing this whooping cough. This usually happens to kids after 100 days. So long time ago in China, we also call it 100-day coughing because it happened on the kids after 3 months, right after 3 months. Now this pathogen is same thing as called the bacterial diphtheria. This is an AB toxin. So they have A toxin, toxin domain, B toxin, transmembrane domain to stop protein synthesis. And this will destroy epithelial tissue. Now, how it happens? They have 2 incubation time, which is 7 to 14 days. At the beginning, it's cold-like symptoms. The mucous membrane will be damaged that. Then later on, it will become a productive cough, prolonged cough with inspiratory gasp. Now, how we do a diagnose? We're using a nasopharyngeal swab. And this is not really a cotton swab. This is a nasopharyngeal swab, which is made by a special material called dacron. So you have this swab, you go to the nose. And how deep you should go to the nose is about 2/2 the distance between the nose and the earlobe. And then you get the swab out and you using PCR, polymerase chain reaction, to do the diagnosis. It's a very quick, rapid testing. And once you find it is positive, you have to use antibiotics immediately. But we mentioned earlier, it should not be happening in the United States too much because we do have a vaccine, DTaP, and the P is Bacteria pertussis. So it did help for the young kids. Okay, this is something else. It is very important. We mentioned this slides before. This means that blood agar is a differentiated media. They can differentiate two major pathogens, which is beta hemolytic, Streptococcus Pyogenes, cause strep throat. You see the clear zone, which is completely transparent zone. And also it can identify alpha hemolytic, which is caused by Streptococcus Ammonium. You see an incomplete hydrolysis of the blood cells, so it's a dark green color. Now we're going to mention about these pathogens. Now, first of all, Streptococcus Ammonium. Streptococcus Ammonium, this is, people usually call it a #1 community acquired ammonia. So 80% cap, community acquired ammonia. What it looks like, it's a diprococcyl, gram-positive diprococcyl. And you will see it's packaged by a heavy capsule. That's why we use a negative stain to do the capsule stain. Now, the very typical symptoms is fever, chest pain, and a cough. Now, remember, this is for the older people. If for young kids, what's going to happen, they usually have another two symptoms, which is cyanosis and ear pain, raising and buzzing. So that's in the young kids a little bit different. This is for adults. Now for the older people, Streptococcus ammonia will happen ammonia. Okay, they have a very polysaccharide capsule and generate a toxin, and rapidly multiply in the alveolar spaces, dominant there. Now, here is something you need to know. We want to mention this in the video also. How we diagnose it. Because there is a lot of Streptococcus in our oral cavity or in the lung area. There's a lot. This is Streptococcus ammonia. And there is another group of the Streptococcus. A good example is Streptococcus mitis. That's called Viridium Streptococcus. So sometimes it's difficult to differentiate because they're all like a chain. It's all gram-positive. So how we do? We use a quick test. On the blood agar, we put a disc on the center. This disc containing some components, which is antibiotics, called opticam. So Streptococcus ammonia not going to grow surrounding the opticam. So we say it's susceptible or sensitive to the opticam. So you see the transparent zone, but on the other words, Streptococcus mitis, like Viridium Streptococcus, they resistant to the opticam. You see they still grow dramatically surrounding the opticam. So we use P-disc to differentiate Streptococcus ammonium and the Streptococcus mitis, which is called a Viridium Streptococcus. Now, Viridium Streptococcus, you can think about it is like a group of various different Streptococcus, including Streptococcus mitis, bovis, mutants. They started from the oral cavity. Now you're gonna heard about the story like 70 years old grandpa go to do take out of the wisdom teeth. Then a couple of days later, he died. It's very surprised. If the dentist did not do a very good dental hygiene, he died. Because Streptococcus mitis, bovis, mutants, those Viridium Streptococcus, they will cause endocarditis, which means inflammation of the heart muscle. So if you have symptoms like that, it's going to cause a dramatic results. Okay, so just let you know, be aware of that. Now, Streptococcus ammonia, usually what happened, it will be rapidly multiplication in the alveolar space, destroy host cells, will fill the blood cells and the fluid. So, of course, you have a fever and a cough. Now, how we do the diagnose? We use X-rays, you do the gram stain, you get the sample. And you do the antibiotic therapy, and you do immunization, the treatment for the infected person. Okay, so that's very important. Now, you need to know, we just mentioned the Streptococcus Ammonia not only cause meningitis, not only cause like ammonia, it could be cause sinusitis, conjunctivitis, otitis, and bacteremia or septicemia. And I mentioned that on the kids, it's very easy to happen is otitis. Otitis, which means you have ear pain, buzzing, and ringing. And the bacteremia, which means the bacteria is in your blood cell. That should not be happening. Your blood cell should be sterilized with any bacteria, no bacteria. Now, bacteremia, we have a septicemia and the bacteremia. Now, bacteremia, which means the bacteria will be colonizing there, also multiplication. Now, septicemia, which means the bacteria only colonize, but not going to grow there. So that's something I want to mention also. Now, we do have a vaccine, which is called a Movax capsule vaccine, which means you get a capsule from the Streptococcus Ammonium, then you parafuse it, then you become a vaccine. So we call it a Pcv vaccine. Okay, get the capital words. So first letter of these letters, so it's Pcv vaccine. Okay, now the second thing, the second pathogen causes ammonia is Klebsiella ammonia. The Klebsiella ammonia, I will say it's only responsible for 2% of the ammonia in the United States. Compared to the 80% cap caused by Streptococcus ammonia, Klebsiella is not a big issue. But the Klebsiella ammonia, most of the time, will cause urinary tract infection, which means difficult to pee, and also it can cause the infant diarrhea. That's a major issue. Now, Klebsiella ammonia is actually a gram-negative coccobacillus. They will grow on the McConkey agar because it's gram-negative bacteria. Look at this colony, which is purple, which is a pink colony, because it's lactose fermentation positive. But when you see all these colonies, can you see that it's like a very heavy, very sticky, looks like a cheese and a milk, is that right? That is called a milk-coiled colony. Because they have a very heavy capsule, so called milk-coiled colony. If they colonize in your lung area, you have a very different cough, like a current jelly. Your coughing is like a current jelly, the sputum sample. So that caused by Klebsiella ammonia, okay? Okay, so we start from here, then we're gonna next we talk about Streptococcus Pyogenes. So we start from here, I'm gonna make some of the video for that. So you read these and also read the video. But later on, I'm also gonna send you some of the self-learning materials that you can read.